Here are two pills, same molecule, same dose, same effect on your body. One costs $10, the other costs $1,000. Not counterfeit, not stronger. Sometimes they even come from the same factory, perfectly legal, and happening in every pharmacy on Earth. To solve this mystery, start with what a pill actually costs to make. For most common medicines, the active ingredient, the chemistry that treats you, is 5 to 15% of the price. Marketing and distribution, 50 to 60%. Read that again. When you buy medicine, you are mostly not buying medicine. You are buying persuasion. Because here's the strange thing about this market. You don't choose the product. Your doctor does, and the marketing machine knows it. In India alone, an army of roughly 1 million medical representatives visits doctors. Samples, sponsored conferences, brand name training from medical school onward. The pitch is aimed at the prescriber, but the bill lands on the patient. And the generic? By law, an approved generic must be bioequivalent. Same molecule, same dose, same release into your bloodstream. Same regulator, same standard. The difference is the name on the box and the marketing budget behind it. Now for the honest half of the story, patents. Inventing a new drug is brutally expensive, $1 billion or more, counting all the failures along the way. So governments grant a deal, invent a molecule, and for 20 years nobody may copy it. That monopoly is deliberate. It's the prize that funds the invention. During those 20 years, the price isn't the cost of making the pill, it's the monopoly doing exactly what monopolies do. Then comes the most beautiful cliff in economics. The patent expires. From that day, anyone may copy the molecule, and the price collapses 80 to 95%. A branded cancer drug at $1,300 a vial. Its biosimilar $300, a generic version, $100, same molecule. So why does the original brand still sell at full price? Because the patent moat expires, but the marketing moat doesn't. Doctors keep prescribing the name they know. Patients don't know a copy exists because nobody profits from telling them. And there's one more trick in the pricing playbook: geography. The same branded drug from the same company sells at wildly different prices in different countries, priced not by cost, but by what each market will bear. Insulin has sold in the United States for nearly 10 times its price across the border. Economists call it price discrimination. Patients call it unfair. It's the same logic as airline seats, except the product is staying alive. And who makes the cheap version of nearly everything? India, the pharmacy of the world, producing 1/5 of the planet's generic medicines with a patent law so strict that companies can't evergreen their monopolies with cosmetic tweaks. Though even that cheapness has a choke point. Most of the raw drug compounds come from China. So what do you actually do with all this? One move: read the tiny text under the brand name, the molecule's real name. Ask if a reputable, certified generic of that molecule exists. If it does, it's the same medicine, minus the marketing premium, because the pill was always cheap. What's expensive is everything wrapped around it, the patent that pays for invention and the marketing that outlives it. Pay for the molecule, not the myth. And if this just changed how you read a prescription, there's more where that came from.